to what the paperwork you got as you came in, your agenda, which is quite important, but also the page that has 3 statements on it, the aims of the seminar. It's important for us to try and bear that in mind. The kind of questions you'll be talking about in the workshops, don't worry too much about that, we'll get to that later. And then that statement that the organisers are keen people really reflect on and be happy that that is, I suppose, does justice to our work this morning and your experience in your area, plus that you're happy that this is the way forward in terms of trying to raise awareness about the bill, so enactment of the bill, and other issues in relation to alcohol within your work. Is that okay in terms of those kind of housekeeping issues? So just to reiterate what you said already about the purpose of the session this morning, we are principally going to look at the bill, historically how we got to this point and the lessons from that, but also its potential into the future. But we also want to try and do that in a way that links to your own fairly recent work of introducing alcohol into the work of the task force, which from my own point of view, I think it sounds like an easy statement, and it slips off the tongue, no problem, but is a very big ask. And what implication has that for you in your work? What has the experience today been? The conversations and the kind of programs you're trying to initiate or whatever. So we try and get some conversation about that, some clarity around that, and see what kind of we can say collectively about that experience. We're also very keen, as you see from the documentation, to be action focused, to say what should happen, what are the views, individually what people can do, collectively what people will do. And then that statement at the end is quite important as well. And I suppose the other thing is my own point of view is I think it's very, I would imagine, it could be very easy for people to come here and be very despondent and be very pessimistic, because it feels like it's been a very tough few years for people working at a community level in terms of drug use and alcohol. And particularly I'm thinking of funding cuts. And it can be hard, I imagine, for people to keep going and to feel optimistic about the future. But I think it is important for people, if people get up in the morning, to be on committees, to be working in a job, to feel that to know that there is a purpose and that there is potential, there's work that can be done that makes a real difference in people's lives, to try and make sure that that's with you all the time. I also think myself that there's probably more potential for the public health approach to the issues you're dealing with. There's more interest in that public health approach has the potential to grow, is growing, and how do we capitalise on that? And also that we are in a fortunate position in that there is an infrastructure there. You are working at a local level. There is some national dimensions to do that, which we didn't have 20 years ago. So that is a good kind of yardstick in terms of doing the work and trying to make the best of that. I was struck on the way in the car this morning on Bridgewood Street. There's a big poster, which I hadn't seen before, in relation to drug use. Maybe they're all over the city. It said something I had took a note of: drink less and great nights become good mornings. Big poster. I don't know if that's new or not, but it struck me. And then I turned on the radio and there's this debate about pregnancy and alcohol use. So I thought, well, there's something out there. Maybe there are opportunities wider than just your own direct work that can be tapped into, or can help garnish public opinion, political opinion, policymakers' opinion. So for what that's worth, I throw that in. So you're all very welcome, and we'll move ahead to the first, the major item of the morning, presentation by Dr. Shane Butler. And I think we're very fortunate to have Shane this morning, and I really mean that, because we have Shane as a person who has serious long-term expertise in this area, from Shane's academic work, from his research work, from Shane's involvement in national policy fora, but also membership of individual organisations working around the issues of drug and alcohol use. So that is a fantastic combination, but also the reflection on that and over quite a number of years of work is at our disposal this morning. So I think that's a very practical use to us. And I think while Shane, I know from the kind of brief you've been given, will be looking at the bill and looking back, but also looking forward, I think it's an opportunity for us in the question and answer session to try and tap into Shane's expertise around the area of work that you're concerned generally, not just about the bill, but obviously about the bill as well. So without further ado, can I hand you over to Shane Butler, who's going to give you the presentation and the topic of the title and